Joe Harper and Frances Jones lead two distinctly different lives. Joe is a former executive enjoying his retirement in suburbia, while Frances is the matriarch of a large Iowa farming family. Joe, a former Marine, enjoys golfing and going to University of Iowa football games with his wife Sally. Frances enjoys rustic life on the family farm, taking care of her husband Marvin. Despite leading vastly different lives, Joe and Frances share something in common, something that has changed their lives forever: heart disease. An avid amateur genealogist, Frances was in the middle of building a family tree, a project she'd planned for years, when it was discovered she needed open heart surgery.
My problems in 2009 had multiplied considerably. They had been coming on for years, and it was time that I knew something had to be done. I went from a real active person who mowed my own lawn, did everything, to where I just couldn't do anything. I could get dressed up and put on a good front, but I couldn't do things.
Joe faced some of the same worries. He always stayed active heading into his retirement, but suffering a heart attack and undergoing subsequent numerous heart procedures presented Joe with a daunting new challenge.
I went through a lot of depression for 3 months. Of course, Genesis put me through the rehab program. I have been thankful that Genesis has been able to provide that opportunity.
The Genesis Heart Institute in Davenport, Iowa, is this region's preeminent provider of cardiac care. From open heart surgeries to the most delicate cath lab procedures, the Heart Institute team saves lives each year.
The vision of the Genesis Heart Institute was to be able to coordinate all the different areas that a patient required for their vascular services. Over the years, the Genesis Heart Institute was able to become a formidable force in our community in delivering care to the post-open heart patient in my case, but also a lot of the cardiology patients.
Equipment that we have in the cath lab is top-notch. All of our interventionists at cardiovascular medicine are highly trained, board certified. Cath lab staff are extremely well trained.
You see a lot of really good programs out there and staying right on top of things, and I always feel comfortable that we're right there with them.
They actually have a physiotherapist that help the patient exercise.
We provide blood pressure support, and we do a lot of teaching. We have education from dietitians, chaplains, management of stress. Emotional support is a big one. Our whole goal is to help the mind, the body, and the spirit. I think that many of these people that are in the program become believers, and they realize that it's become a way of life. They're all very dedicated, and Joe is one of our most dedicated.
When you meet Joe, you find out he's a very likable individual. Dating back to 1990, he underwent a 4-vessel bypass surgery with Dr. Bill Dipple at that time. He had procedures in 2003 and 4 and 2005 for replacing stents.
Genesis has been able to, along with the doctors, prolong my life. And with the research that Genesis is able to get into and actually provide and work with the University of Iowa and other universities, we are prolonging life more and more.
Most of our patients are right here in Davenport, in Bettendorf, Rock Island. There are some patients that come from further out. Frances Jones is a dear woman. She is, by all means, the matriarch of her family. When I saw her and evaluated her, she needed an operation to correct her atrial fibrillation. She had 2 valves in her heart that did not work because of the enlargement of her heart. And then she had coronary disease, so she needed also bypasses.
Dr. Agelli told me that I could have good years. And this came out just like Dr. Agelli said it would. Genesis just was so wonderful all the way around.
Francis and Joe now live with heart disease. It's a part of their lives, lives that have been given new hope and a new outlook, thanks to the expert and compassionate care they received through the Genesis Heart Institute.
Over the next few years, we will be getting more new cath lab equipment. The arrangement of the cath labs is going to be more centralized.
We had a group from Yale and Mayo that were assessing the total percutaneous coronary intervention program that we have here. He said, well, we've been identified as having one of the lowest 30-day mortalities in the country, in the top 5.
There is so much talent at Genesis, and we're very lucky to have such a fantastic staff in our area. And I can't say enough about them.